I will be speaking on how to implement diagnostic stewardship. If you see the relation between diagnostic stewardship and antimicrobial stewardship, it can be said that we are too early on implementing antimicrobial stewardship in the fight against antimicrobial resistance. What comes first before antimicrobial stewardship should be the diagnostic stewardship. Diagnostic stewardship is more focused towards diagnostics. It's diagnostic centric, while antimicrobial stewardship is more pharmacy centric. That is antibiotic centric. Let us understand the relations and the chain or interlink between the diagnostic stewardship and antimicrobial stewardship. Let us understand the patient flow during his treatment. Patient first get evaluated for the signs and symptoms by the clinicians. On the basis of his signs and symptoms, the diagnostic tests are investigated by the clinicians. On, before the diagnostic results are available, empirical antibiotics are prescribed by the clinicians. And then on the basis of the diagnostic test results, the antibiotic is modified accordingly for its type, duration, and frequency. So this is how the flow of the patient is in during his treatment plan, right from signs and symptoms evaluation to the modification of the antibiotics. In this process flow, let's see the interventions in terms of diagnostic stewardship and antimicrobial stewardship. Diagnostic stewardship, the interventions include ordering for the diagnostic tests based on the clinical signs and symptoms, and then specifying collection, storage, and transport, and then reporting of the diagnostic test. So you can say that this is a pre-analytical, this is an analytical, and there is a post-analytical phases of diagnostic stewardship. So in all these three phases, there are interventions as required that should be rational as per the principles of diagnostic stewardship. We'll see in details those principles in the next successive slides. While in antimicrobial stewardship, we take care that there is a rational antibiotic that is being prescribed, and based on the proposed prescription, the antibiotic is reviewed accordingly. Let us understand the core elements before of diagnostic stewardship before we see how to implement it. The core elements of diagnostic stewardship includes leadership commitment, accountability, expertise, action, tracking, reporting, and education. Now, leadership commitment is the most critical and important prerequisite for implementation of diagnostic stewardship, wherein the leadership commitment includes dedication of necessary human resources, financial, and IT resources. Then a leader needs to be accountable and needs to be appointed and accountable who will be responsible for the execution of this program and responsible for the program management and the resources. Then comes the expertise. There needs to be a expertise who usually will be a clinical microbiologist in this program to lead the implementation of the diagnostic stewardship. Then actions are the other core elements of diagnostic stewardship, wherein there are different interventions for diagnostic stewardship which needs to be implemented and audited, and feedback should be given to the team and the stakeholders. Then monitoring of the microbiology tests, tracking the impact of the DST interventions and other such outcomes comes in the tracking component of diagnostic stewardship. Then the other core component that is important is reporting. So when we are doing our implementing our actions and tracking it, it needs to be regularly communicated to the stakeholders in terms of the key performance indicators. So so that the necessary actions will be taken for the improvement and the modification of the program. Then finally comes the most important other core element, that is the education. It is said that eyes can see what the mind doesn't know. So education is very important and the critical necessity required for implementing diagnostic stewardship. So education of the doctors, nurses, pharmacists, and other team members needs to be done at a regular intervals, and it should be continual basis for diagnostic stewardship. Let us do the prerequisite for diagnostic stewardship. The program site should have the relevant clinical, laboratory, and epidemiological capacity, access to the laboratory with good quality management capacity, and capability to perform microbiology diagnostics according to recognized standards. Then the logistics, the transport of the specimens, and the communication between the surveillance site and the laboratory, between the clinical site and the laboratory and the surveillance site, must be organized to ensure that the specimens that are collected should be processed without any delay, and the results can be reported back to the clinicians and the surveillance staff. There should be a transparent procurement policy in place, and a tender documents for the diagnostics and the laboratory materials must be available. So that was about the prerequisite for diagnostic stewardship. So before implementing diagnostic stewardship, we should have done we should also do a SWOT analysis, that is strength, weakness, opportunity, and challenges analysis. An initial review of the existing protocols, guidelines, resources, that which includes human and material and financial resources and outstanding needs, should be conducted prior to planning and implementing diagnostic stewardship activities at this surveillance site. Any potential barriers and constraints that will impede the use of microbiology diagnostics should be identified and documented. Based on the findings of the SWOT analysis review, a realistic plan needs to be developed for the gradual implementation of diagnostic stewardship. The extent to which the plans can be implemented is likely to depend upon the priorities of the surveillance system and the surveillance site, as well as the resources that are available and the number of patients that present to the surveillance site. So that's about the SWOT analysis that is important for implementing diagnostic resources and budget. A budget for the implementation of the diagnostic stewardship activities at the surveillance site should be formulated and approved by the senior management of the surveillance site. The cost estimation should consider the requirements at each stage of the diagnostic pathway, including cost of developing the local guidelines, the protocols, policies, and the cost of developing the training materials too. Reimbursement for the diagnostics differs depending upon the structure of the healthcare system and the coverage and may have negative impact on sampling. So what do you mean by negative impact? Means the reimbursement of the microbiology, since microbiology is an expensive diagnostics, cost effectiveness needs to be considered in such a way that should not have a negative impact on the collection of the samples from the patients for diagnosis of infections and resistance. Then actual implementation cost and outcome parameters could inform cost effectiveness studies and policy. So the cost and the outcome parameters needs to be monitored at regular at continual basis. So this is how the key performance indicators of diagnostic stewardship should look like. The key performance indicators help us to monitor the progress of the program. It should be time-based monitoring of the program in terms of say short-term, medium-term, and long-term. Short-term can be said less than 6 months, or medium-term around 1 year, and long-term say around 2 years. So this KPIs needs to be achieved. Say short-term should be achieved by 6 months, medium-term by 1 year, long-term by say 2 years. That's an example that I'm stating. Every hospital or healthcare setting can have their own KPIs and the time frequency of achieving the outcomes. The short-term KPIs can include indicate parameters like improvement in the knowledge, attitude, and practices related to diagnostic stewardship. Then the medium-term KPIs could include percentage improvement in the compliance towards interventions of diagnostic stewardship, which includes the interventions which includes the right test as per the clinical setting, right patient indication, right time of the test results, right test interpretation, right antimicrobial prescription, and right time of the antimicrobial administration. So these are the different interventions that needs to be monitored as key performance indicators on a medium timeline basis. Then long-term KPIs include the decrease in the incidence of multi-drug resistant organisms or decrease in the incidence of healthcare associated infections. So these are the different key performance indicators that need to be monitored and implemented and monitored. Thank you, and we'll move to the next session.